Can everybody hear me? Good. Okay. Had less technical difficulties this time, but here we are. Today's March 24th, 2022, Thursday, 11:09 a.m. And we're back for another weekly update for the Pueblo for Health and Human Services and for the COVID response team. And I am Troy, the Health and Human Services Director. The rest of the team we have on are Rebecca Jolin, Public Health Nurse, Claudia Lente, Community Health Representative Generalist, and Thelma Gonzalez, Community Health Representative Manager, and all part of the COVID team. I'll wait a couple more minutes and see if anyone else wants to join us live. I'm going to take this banner down here because it blocks Thelma's face up there. Don't want to do that. Okay, so we're going to go ahead and get started to give our weekly update. So, as far as COVID is concerned, the Pueblo's still doing pretty well. We only have one active case, and we've only had one active case over the past, I believe, 3 weeks, which is definitely a good sign. No new cases this week. We have a total, since the beginning of the pandemic, we've had 218 cases for the Pueblo, with 215 having recovered. One of the good signs that we're noticing is that the state of New Mexico cases and the United States cases in the United States are dropping. They're continuing to drop. The challenge, of course, is we're looking at reports of the new Omicron variant that seems to be increasing across the world as well as in the country. So we want to keep a good eye out on that because it is something that could change the trajectory of how the Pueblo moves forward with regard to the reopening plan that has been released in the March 15th version of the executive order. So if you've been seeing the Omicron variant, the BA2 variant, or some call it the stealth variant in the news lately, and wondering if it's going to be a concern, it could be in the future, but at this point, we're in pretty good condition in the Pueblo. As long as we continue to practice the COVID safe practices and guidelines, I think we're going to be in pretty good shape, especially since the new variant is a derivative of COVID, subvariant of of Omicron. Symptoms are about the same. They're not affecting folks as much as has been in the Delta, the time of Delta. So hopefully there's not going to be any issues with that. I'm having a little bit of a delay. You guys hearing that delay? No? Okay. So before we move on to the rest of the agenda, I wanted to kind of just bring up the oops. There's other folks in the waiting room that I didn't see there. Sorry, LaDon and Raylene. I wanted to bring up the reopening plan so that folks can, if they had any questions, they can put them in the comments and kind of give people an opportunity to ask any questions if possible. Because, it is something that some people have had questions on. We are in phase 1, which is the first phase of the reopening plan. which has some relaxed guidelines, but still being somewhat protective because we're trying to determine if allowing more access and more gathering sizes is going to result in a higher number of cases for the Pueblo. So giving that 21 days in each one of the phases is going to help determine if we need to continue moving forward into phase 2 and into phase 3, or if we need to stay paused in phase 1 for a little while and make sure that there's not going to be any major outbreaks. So I just put it up on the screen, give anybody who's watching an opportunity to ask questions if they have any. I'm hoping it's self-explanatory on the reopening plan to what the differences are between what was and what will be in the future. But we are currently in phase 1, and if everything goes as normal, we will move into phase 2 on April 5th, and there'll be a few less restrictions and more signs of the Pueblo returning to normal. And there's a comment. Sean, is that us that has the bad signal, or is that you that has the bad signal? I'm hoping that's not. Okay. I'm having some issues with little breakage in signal as well. I don't know if that's my side or if that's just how it's coming through. Any member of the team have anything to add to the reopening plan, or anything that you want to bring up before we move on? Okay. Wow. Okay, so that was the reopening plan was added to the screen. Somebody drop off. So now we're going to go into just reminding everyone that as we reopen, there are a few things that are going to help keep our cases low. One of the primary things to keep our cases low is making sure that you're vaccinated, and when you're eligible for a booster, you get your booster shots. Because even though there is science saying that it's not stopping everyone from getting COVID, it is keeping folks from getting seriously ill or becoming hospitalized, and in many cases keeping the viral load in people's bodies low, so that the spread is not as easy as it was prior to vaccinations. Vaccinations are still available at IHS. There are no mass clinics with IHS being planned. I know that DOH is still offering them across the state. I think the one that was local here at the Milwaukee Fire Department is not. I don't think they have one scheduled in the near future, but they are still offering them. Those are the only mass vaccination clinics that are available. But vaccines are still available at IHS, at your local pharmacy, and at your doctor's office if you can't make it to the pharmacy. So there's been a lot of news lately also about vaccinations and changes in eligibility. There are a lot of questions about the under 5 population getting vaccinated, and the most recent information has stated that Pfizer was the first one to submit their request for emergency use authorization for ages 6 months to 4 years of age. and they had a delay trying to get more information about the vaccine or the information from the studies. So they're expecting an answer on that between the end of April and the early part of May. But last week, Moderna also submitted emergency use authorization request for children between the ages of 6 months and 5 years of age. So they're expecting those two responses to come back sometime soon for those who are still wondering when they can get their children vaccinated. Those apparently are coming, but it's taking a little longer than we expected. Pfizer also recently submitted an approval request to the FDA for a second booster shot, ages 65 and older. So that's pending. That's coming up sometime soon. And Moderna has also submitted another request for FDA approval for a second booster for 18 and older. Don't know when the last two booster shot requests are going to be reviewed, but there's going to be reviews of the request next month during the month of April. So maybe we'll be hearing something sometime soon. But the reason why I'm bringing that up is that as our immunity start to wane and decrease from our last booster shot, we might want to start considering that next booster when it becomes available sometime in the next couple of months, hopefully. We're still doing testing here at the HHS building. If you are symptomatic or you're feeling sick and you think you might have been exposed to someone who's tested positive for COVID, give us a call, 505-252-5986. That is the COVID hotline. You can contact us and ask us questions about anything COVID related, but you can also call us and schedule testing time to come in and test to see if you have COVID. As far as COVID is concerned, that's all I have for the update. Does anybody else have anything to add, to share?
Just want to remind everybody or the community that we do walks on Tuesday and Thursday. And today we have a walk at 2 o'clock. So meet us at the softball field and have a nice walk. Join us and we'll be there. Thank you.
And on the topic of walking, we are going to be changing the time for the walk in the month of April because it is warming up. So starting April, was it 5th, Thelma? Is that what it was? April 5th, we're going to change it to walking at 9 o'clock a.m. Tuesdays and Thursdays instead of the afternoon walk that we're normally doing. So was that correct, Thelma? Is it the 5th? Okay, April 5th. Reeling, thanks for bringing it up. So, you want to talk about it?
Good morning, Sanai. I hope that you guys are having a good day. The COVID response team will be having a vaccine incentive next week, Thursday. We have not set a specific time, but we do know there will be a couple hours in the morning and a couple hours in the afternoon, and it'll be on Thursday, April 31st. It'll be a drive-through here at the medical building. What you need to have with you or you need to inform us of is that you have received the third booster. For the kids that are vaccinated, they should have received the initial series, which is the first and second dose. So please look out for that information. Please share that information with your family and friends once that information is posted, hopefully by the end of today.
Just wanted to correct. April 30th.
I mean March 31st.
Sure.
Sorry.
And we know what you mean, but we want to make sure that the community is aware that it is March 31st
Yeah.
for next week. But we have to, one of the reasons why we're opening up is because we are at a position where we are at a pretty high percentage rate for vaccinations, and the community should be rewarded for that, because the work that has been done to keep the community safe is not just what the COVID response team has done, it's what the community has done to get themselves vaccinated and to follow the executive order, and doing your social distancing and washing your hands and wearing your mask. Everybody needs to be, to pat themselves on the back and thank their, families and friends for, doing those things. The vaccination is a huge part of the reason why we're in a position we're in now. And so the incentive is basically going to assist folks, especially during this time of high gas prices and increased costs. Incentives are sometimes a good thing to have. So it's not just going to thank you for your vaccinations, getting your vaccination, but it's also going to be able to help you, make some purchases that you might not be able to because of the high prices. And when you come down, what we'd like and what is preferred is if you have your vaccine cards or a copy of your vaccination cards or a picture of your vaccination cards on your phone, or the printout from the state VaxView, NIMSIS website showing that you got your vaccinations, whatever you can bring to provide proof that you're vaccinated with that third dose, it would be helpful for us, because it's hard for us to determine who is vaccinated without any kind of documentation. So handing out incentives is not going to be possible unless we have that proof. So next week, March 31st, watch out for the announcement. There's going to be one in the morning, one in the evening, that we're going to do the incentive giveaway. If you have any questions about that, you can call the COVID hotline, 505-252-5986, and we can give you more information about that.
Troy, I have an announcement.
Yes.
Okay, I just wanted to announce to the community in reference to the Senior Farmers Market Program. We're taking applications right now. I can be contacted at 455-4115 or my cell 2319401. And this is for seniors beginning 50 years of age and older. So I'll be delivering applications to the seniors, but if you have any questions, you can contact me at my office. Thank you.
Thank you, Claudia, for that. So an additional update. So the SDPI program has been working pretty diligently to develop opportunities for the community to have places to engage in physical activity, primarily gym memberships, which we've been working on for more than a year now, and we've had a lot of different delays, a lot of different things that have caused us to not be able to provide the service. But I am happy to report that 2 of the 3 gyms, Anytime Fitness Española, Anytime Fitness Los Alamos, has signed a contract. We have confirmed agreements, and we're still waiting on Milwaukee Wellness, but we're expecting to get that sometime within the next couple of weeks to have that approved as well. But what I wanted to announce is that we are going to start taking applications for the fitness program to get folks set up to get gym memberships. And so there are a couple of requirements that need to be followed for this process. And I'm going to try to make sure I'm putting up the right document here. To look at what we have here. Where is it? Is this the application? Okay. I don't know if you all can see that, but what this is the application. And it's a 2-page application that everybody who wants to participate in the program is going to be required to fill out. One of the points that I wanted to make on this is that there are requirements. This program is a pilot program, and it's designed to determine what the interest is going to be in the fitness program and how many people are going to get signed up and getting involved in this program. So your participation is important. If you are interested in getting a membership, or if you already have a membership at one of the Anytime Fitness locations and would like to be part of this program to have some assistance with your memberships at the gyms, contact us and we can get you one of these applications to fill out. The preference for this program, because it is a diabetes prevention program, is if you are enrolled in the SDPI program or either as part of the target population, you will get preference for this program. So there is a portion of the program that is a prevention piece, but the treatment piece, those who have already been diagnosed with type 1 or type 2 diabetes are going to be given preference in the program. As part of the program, you will have to complete a survey every single month. We will talk about the survey once you come down and put in your application for the program, but the survey is required to have a continued part of this program. You also have to go to the gym. So if you sign up and we are covering your gym membership and you choose not to show up, at the end of 3 months when we evaluate usage and the completion of your survey and to see what your commitment level is, if that commitment level is not there at the end of that 3 months, then your membership will not be continued through the Pueblo, and someone else that's going to use it will have an opportunity to use it. So there are minimum requirements for the program, and we don't want to go into detail on this update, but I did want to make sure that everyone knows that by April 1st we do want to start having people bring in applications so we can start processing them for membership. That is something that we've been waiting for a very long time, and I'm kind of glad that we finally are able to say that we can do that. So yes, is for travel membership primarily, but it's travel membership and also travel employees that are eligible for the program. In the pilot program, in the phase 1 portion of the pilot program, it will expand depending on funding, of course, but at this moment it's going to be travel enrolled members only, and we will and travel employees, and we'll evaluate it after that later on. I don't know if anybody has any questions about that. Now, if you look at the manual, it will be expanded. I don't know if you can see that, but it's going to get expanded to include spouses of spouses of travel enrolled members. Of course, people that are legally married. Those folks will also be included in the eligibility later on. But as of right now, we can. It's only going to be travel enrolled members or employees only. And with that, let me see. Did you want to talk about the associated portion of that? Oh, is she even in there? Associated portion of that, Victoria, on the assessments? I don't know if she can hear, but I don't think she can hear me. Oh, there's Victoria. On LaDon's screen. You're muted, but...
Oh, no. Sorry, having technical problems. What was I supposed to report on? I'm sorry.
So I wanted to know if you want to talk about the associated fitness assessments to the fitness program.
Oh, okay. We do have our equipment in, and to start the fitness assessments, whoever's interested can come and start. We'll record your data, go from there.
And it's a great opportunity. And folks usually don't get an opportunity to have someone sit there with you, go over your fitness goals and questions, and really evaluate where you are fitness wise. You have to get a personal trainer at the gym to do that, and that costs money. But what the Pueblo is doing as part of this program is to offer that free for the community as we come out of COVID restrictions and lack of activity and, not really doing much. People are going to need to know where they are so they don't try to rush back into the gym and try to, engage in physical activity full force without really knowing where they are. What Victoria's talking about as far as assessments are concerned is there's going to be evaluation for your body mass index, your flexibility, your aerobic capacity, what am I missing, Victoria?
Let's see, height, weight, BMI, body mass, what else? Flexibility, the 3-minute step test, what else? I think that's it.
And I think in the beginning, that's where we are. Go ahead.
Measures.
Oh, yes. The girth, so your inches, basically there's two ways to determine your body fat index, your body fat percentage. And one is through a pinch test and one is through a bioelectrical impedance machine, which we're going to do both of. But one of the things that determines risk, that can kind of tell what your risks are for certain chronic health conditions is, waist measurements and different measurements of your body. So when she's talking about girth measurements, that's what we're looking at, trying to determine what your measurements are of specific body parts to see where you are. And then, the periodic review of that will determine what your progress is as you move forward. As you get back into physical activity and you want to have smaller legs or smaller arms or wherever, those measurements are going to tell you where you started and also tell you where you are when you come back. What were you doing a Victoria, you're saying every 3 months, every quarter?
Yes.
Every quarter. So every quarter you'll get a measurement and you kind of figure out where you are there. And it's a good service that some people never have an opportunity to receive. So we're offering it to you. So if you have a desire to have that done, you can contact Victoria Martinez and Healthy Kids, Healthy Communities program, and she can set you up for a meeting. Thanks, Victoria. So April 1st, we're also having a car seat clinic. It's going to be in collaboration with Aztec. They're going to be coming down to the Pueblo to do car seat installs and car seat install checks, safety seats, to kind of determine, if you've installed your safety seats correctly. They've had them in the community before, and so Aztec is coming out to offer a new one for this year. What is it? Is April 1st? Is it 8:30 to 11:30? Is that what time it is from, Claudia?
Yes, it is.
8:30 to 11:30.
At the
So,
senior clinic.
but you have to sign up. You have to make an appointment. So call us 505-252-5986 or call one of the CHR offices and they can get you registered for the event. I don't see any questions. So LaDon and Rebecca, you have anything from the CDC Foundation that you want to throw into the conversation? Maybe an introduction to the idea of a community health assessment that's coming up?
You want to go first? Okay. So, hello everyone. We've all been kind of working on different pieces to gather information, and I've been reaching out to a few individuals. We would call them stakeholders. I forget what Raylene's term was. We have some individuals we want to reach out to gather information, to identify some of the health concerns or health related topics. I feel this is going to be important. It's also going to it allows us to get the ball rolling on this community health assessment. So yeah, if you have any ideas, or I've been talking with to see who we could reach out to, and I have made contact with a few individuals just to sit down to see what topics we could discuss. And Troy and Rebecca will probably be also reaching out to individuals within the community, just really trying to get support on the topics we're each looking to gather information from. But yeah, appreciate any feedback.
Yeah, so the community health assessment is really important for everyone. When you have an opportunity to participate, give feedback, answer questions, all of that information and data that we get helps improve the services that are offered to the community. So the more feedback that we get and the more participation that we get, the better the results are from all of the collaborative work we do together. And I'm really excited for this project. This will be one of the first ones that I'll be working on. And I'm excited to see what we can do and where we can take this to help everyone work collaboratively and have services and things that help people and that are useful to everyone. So if you get a survey or if you get a call or an email, talk to us, let us know what you'd like to see in the future, and let us know, how you feel about things currently. And so that will help us gauge, what we can do to make improvements.
There's in conversations with community members, different members of the Health and Human Services team, we get a lot of questions about, why are you all not doing this? And why are you all not doing that? And why are we not having these services? And, to be honest, a lot of these services that we should be providing, we don't have funding for, or we don't have the ability to provide the services because we don't have a plan that has been developed to help us to guide the path that we have moving forward. And the only way that we can get those things, whether it's funding or really understand what the needs of the community are, is by getting input from the community and other stakeholders. That's what they call them, people who have a vested interest in the health and the services of the community. And all of you are the primary stakeholders in this. Members of the community, or the state and the county and the local governments, they have the ability to go to some database at their doctor's office or to some state database and get data on the people in their communities, where that they can use to create these these plans and to apply for grant funding or funding. But in tribal communities, it's not that easy because we don't have a central database to get that information from. And the only people that have that information are you all. You own the data, you own your information, and the only way for us to get that is for us to collect it from you. Now, these surveys are going to be anonymous. You're going to be able to provide this information honestly and truthfully, without fear that people are going to know what that is from you. But it's going to give enough data for us to support how we guide our services through HHS, whether it's through the CHR program or SDPI program, or the mental health services and substance use therapy services that we are so desperately needing in the community. But in order for us to justify what we do and guide what we do, we need that information. So if you get a survey, or you get a call as one of the key informants, or people that we're asking information from, or being part of a focus group, consider participating and putting your 100% into it, because we do need your help to find out what exactly the community is in need of, and what the strengths are, what you actually have here, so we don't try to duplicate what's already here. So there will be incentives involved, but we'll have a conversation about that in a later separate community announcement. So speaking of announcements, before I go to that, does any other member of the team have anything else to add before we shift? Raylene?
Again, this is Raylene Martinez, and I also want to apologize, because we did have the National Nutrition event last week, Thursday, at the El Rancho property. And, I do want to say that, I'm not sure, for whatever reason, mask wearing went out the window that day. And I apologize, if we made anybody feel uncomfortable by the staff not wearing masks. We did receive an email prior to that stating that staff, could choose whether or not they wanted to wear a mask inside the tribal buildings. And so, I think that was where maybe my confusion, or I just want to apologize for that. I hope that the people that were present enjoyed themselves overall. And I'm thankful that there was some participation. But I would love to see many more individuals at our events so that we can have even more participation and things that we're trying to achieve within our programs.
I wanted to echo what Raylene said. The tribal administration did, tell us that staff, it is personal choice at this point whether we want to wear a mask or not in tribal buildings. And the COVID response team, which was pretty much everyone that was there, as part of our process, we get tested weekly to determine whether we are positive or not. And so we had a couple of layers of protection, that we felt, strongly about, that we were not putting anyone at risk. But I think that, not wearing our masks did kind of give some people some, they were not really liking the fact that we were present without our masks. But, we talked about it after the fact and realized that, regardless of whether we were given that permission to not wear a mask, and we test regularly every single week, that doesn't, mean that everybody else is comfortable with that, especially when the community comes in and they're part of a community engagement event. And so we, as a team, want to apologize to anyone who felt like either it was an unsafe situation where we weren't wearing our masks, or it was giving off the wrong impression as members of the COVID team when we weren't wearing our masks. But not that we're trying to excuse our behavior or make excuses, but we did want to apologize for anyone who did feel uncomfortable with us not wearing our masks, because like Raylene said, we were just told that we didn't have to, and it was kind of made us feel really good not having to wear masks, but it did create a little bit of an issue for some folks. So I wanted to also apologize for the perception that was out there. So anyone else have anything? Okay, well, we have Summer in the waiting room. She's still waiting. I'm glad you're still here, Summer. I'm glad you didn't, leave us. And Summer has an announcement that she'd like to make on behalf of the Tewa Language Outreach Program. And so I'm going to turn over the last portion of the updates to Summer so that she can provide the information that she'd like to provide before we sign off.
Good morning, everyone. Nicole Summer Martinez. I am currently the Tewa Outreach Coordinator for the Tewa Outreach Program. This is only outreach to where we are going to start assessing the number of fluent speakers we have here in the Pueblo of San Ildefonso. I appreciate the Health and Human Services giving me the time to sit in on their broadcast to the community. So this assessment is for the fluency level of each individual within the village. And this is a self-identified fluency level. In no way are we going to assess you at all. It is up to you as community members to assess where you are, to help us gather this information so we can start documenting word pronunciations and syntax of our language. Syntax is how we arrange our words, how we make sentences, and how we make discussion. So I will be going door to door to the 190 homes within the Pueblo. Granted, we are still in the phases. So next week, the Health and Human Services again is allowing me to chime in at the end of their next week session. But that evening on March 31st at 6:30 p.m., there will be a community information session on this program at the El Rancho property at 6:30 p.m. And everyone is invited to attend if you can. We're still kind of in the phases, but we would appreciate as many people to come. Personal invites are trying to be handed out this week. We are definitely trying to do that. We definitely want to get community input on the fluency scale. This is only a scale that will be used within Sinai to where we rate, or you will rate yourself on how fluent you feel you are in the language. And then we will use this information and it will be made available for the Pueblo to utilize in their programs moving forward, in other grants, in other avenues they explore with the Tewa language. So this is a lot of information in a short period of time, but we are here. Anyone that has my phone number, 505-629-5046, can give me a call if they have any questions. We will be sending out a blast through the call system that the tribal administration uses. An email will be going out to the same email that the Pueblo uses for informational purposes. And again, we're going to start putting out personal invites, especially to our elders who are not on Facebook, so they can utilize this information and help us. Because, I don't consider myself fluent. I don't consider myself a teacher. I consider myself a learner and one willing to help get this program moving forward. And I think, we're all on that side of the field in sort of different kind of words to use. But I appreciate the time, Troy. I appreciate you working and utilizing your technology to reach our community. I appreciate your team. Definitely always good information on your broadcasts. But thank you.
Thank you, Summer. Appreciate it. So next week we'll have you again on at the end of our broadcast to provide that additional information. So, anytime you need us, just let us know. We're here for you.
Did anyone have any questions on the team or in the chat? No? Okay. Thank you.
There's no one in the chat, so I'm assuming that no one has any questions. And if they come in later on, I will get those questions to you.
Great. Thank you, sir.
Thank you. All right, folks. Anybody have anything else to add before we close? Oh, Leanna, is that for Summer? Okay, so the presentation on March 31st in the evening will be at the El Rancho property. Let's see, language information. It's at 6:30, I believe, is the time. We're going to have our distribution for the vaccinations at I think it is probably going to end somewhere around 6. So she was going to give the community an opportunity to have time to get over to El Rancho property. So I think it's going to be scheduled at 6:30, at least based on our conversation. That's what she said. I'll put that in the chat. All right, I think that is it. We're down to 11:59. We have about 32 seconds left. Anyone that's on the screen, whether it's Claudia, Thelma, Raylene, LaDon, anyone have anything to add before we close? Okay. Well, Sadai, thank you for listening in, whether it's live or you're going to watch this later on. If you have any comments or questions, it doesn't matter if we end this at 12 o'clock or not. You can enter the questions in the comment section, and we will actually get those answers to you later on, because we will review them as they come up. So whether you're on YouTube or on Facebook, we monitor those questions regularly. So if you have any comments or questions about anything that was talked about today, put them in the comment section even after the fact, and we will get to you as soon as we can. If you have any questions that you want follow up on that you don't want to put in the chat, you can call 505-252-5986, and someone will get some answers for you. Other than that, thank you all for tuning in. I appreciate your time, and have a good rest of your Thursday. Goodbye.